May has been the mental health month, and as usual, you know that inclusive reflections, we have always tried to bring you episodes and knowledge of what mental health is all about. And today, it's an amazing day because we have together decided to partner with Cynert Hospital and Rehabilitation Center, which is in Embu County, and so that we can be able to discuss what mental health is about. So this episode today, together with me, is an amazing man that I knew when I was a little bit young. He is a sports coach, and part of the stress management and mental health coping mechanism, we have things to do with exercise and all that. So I am going to introduce him to us, and he is going to take us through what he does. What is the relationship between mental health and exercise? How is it our mental health wellness is related to a physical health wellness? So, Mr. Njeru, good morning, sir.
Good morning.
How are you?
I'm good.
Kosalama.
Sana.
Good to see you.
Fine.
Looking all nice, dressed up by Cynert, sporty as usual.
It's true.
So, together with Cynert Hospital, we want to discuss about mental health today.
Yes.
Considering it has been Mental Health Month, the month of May. Today is 1st June, so we are not so late to have this discussion. And I know that you are a sports coach.
Yes.
We want you to bring us into speed of what relationship does mental health and exercise has to do with the other.
Karibu.
Yes.
Asante sana. I'm Steven Jero. I'm a coach in athletics. I'm also a sports person. I started playing football when I was 12 years old. Up to 20 years old, I discovered that I'm good in athletics. And so I ran for my district up to the national level. And that's why I liking to bring the youth together. Then, as I've been asked by Terry, one, we are happy to have this Cynert hospital. Is an idea which came with Dr. Njoka, and I'll tell you that it is a unique one in this country because I've gone across so many rehab centers and I've not seen anybody being incorporated in sports. When we're talking about mental health, some people think that they are very healthy and because they are not in the rehab, but all of us are sick. One, we have the stress, we have the depression, and we are just outside. These people who are in the rehab, it's only that they are a bit weaker than us. And you see that what lacks in our brain is the oxygen. Mostly when we want to faint, when you're having depression, when you're having the stress, is that you have the less oxygen in your brain. And what makes exercise to be now better to the person who is in the rehab is there's something we call endorphins. Endorphin, when you exercise, is released to the brains so that the oxygen flow can be better. The other one is it reduces the endorphins reduces depression, anxiety, and also the stress. So we encourage them because their problem is in the brain. It is not with the other parts of the body. It's in the brain, so that the endorphin can be triggered, so that they can be helped in their brain.
All right. I saw someone saying that mental health is like a muscle. It strengthens as you practice. And I know there are some of the movements that you can have with your body, and they can help you to be able to relax. There are people that go to the gym, but there are people that don't have time to go to the gym. There are people that have just a compound, they can be able to do some few exercises. So I don't know whether with your permission you can show us what are some of the exercises that you do with people that are brought here? Because I know that you handle people that are here for rehab and you handle people that are here for mental health sessions. Yes.
Okay, thank you for that question. I don't like people going to the gym. Because if you don't get the correct instructor,
yes,
then you overload some of your muscles, and that leads to death.
True.
Okay, what we encourage is swimming, and then jogging, and the exercises.
Okay.
Because you do them with all parts of your body. Swimming is the best because even the air, even the eyes, the nose, because of the water, all muscles they move. So we do jogging. When we jog, you jog this way. You raise your knees up. You don't jog this way. We also have what we call trotting.
What is that?
Trotting is we are not walking and you are not running. Okay. You are not jogging. It's between the walking and the jogging. So when you trot, you don't raise your knees very high. So the people who are here, because of their mental problem, we start with trotting. Because when you start with very high exercises, then they'll feel the muscles will not be very, very comfortable.
Yeah.
And you see the muscle is like is elastic.
Yeah.
It can tear anytime.
Right.
So we do the trotting. The trotting is just this way.
Yeah.
That's the trotting. Then we move to jogging. When we do the exercise, we have the part of the body. We call this one, this part, the lower part, this part from here.
Yeah.
This is the gearbox of the body.
Of the body.
Okay. We also have, this is the engine of the body. So you'll see most of the exercise we do like squatting. You can squat. Okay. You can do it. God. Yeah, you can do it.
Let's try.
Let's just try. With the toes. So you go up, you go up, you go up, you go up. Yeah, that's good. Then this one is for the knees. Then you come here, you touch your toes, you count 10. Okay, you come up, you come here. Okay, go back, come here. I think will you be able to write down?
Yes, of course.
Okay. Come here. This one is for the pelvic.
Okay.
This one is used mostly by the men because of the pelvic. You know, there are people who urinate every time. So when they do this kind of exercise, the muscles of the pelvic, they will be able to block the urethra or the bladder. So you'll not be able to be urinating or anyhow.
All right.
So you go this, you come. Okay?
Yes.
You do it this way now. This one is for this part.
Yes.
You can do it. You count up to 100. That one helps there. The gearbox. Okay. We also do the.
All right.
We also do the press ups.
The press up. Jesus. This one I can go only one.
Why? One up. One up. One up. One. Up.
That one is not meant for me.
So you see, then when we are relaxing, relax your muscles this way. Okay. That way. Okay. You can turn the hand. You can turn the other one. If you turn this 5 times, you turn this 5 times.
Okay.
Not 4, 5. It is 5,
to be
5.
Same. All right.
It's the same. Okay. Then you can have the hands at kimbo. When you come hands at the kimbo, you move the body. You move the body when your feet are straight.
Yeah.
Don't bend the knees. Okay, this one, it makes the what? The gearbox.
Okay.
Yes. Then there is another one of the brain. You know, all these exercises are the ones which we are doing when we are very young. And you see, it is a God sent something.
Yes.
So you start turning the
head.
The head. If you turn it 10 times, you turn the other side 10 times. That is, this one is in the field. When you fall, you're not because now the brain is used to move around.
Yeah.
Yes.
Most of the time, it's funny how we don't think exercise helps, and someone might not be able to tell entirely what is the relationship between. You see, for someone that has been doing exercise just as normal, like let's go back. When we were growing up, we used to do PE. For us, we just thought PE is just a game. It's just us going out breathing. But right now, when we talk of mental health, we are talking about someone being intentional about it. And I know that personally, we have come across companies that even create time for people, because when we are talking of mental health, we are not talking about for the people that are in rehab and all that. We are talking about mental health all around. We are talking about the wellness of the staff in a company, even maybe in such kind of a facility. What would be your parting shot when it comes to us and an individual taking charge of exercising and using maybe the available resources for them to be able to understand why is it that I need to jog? Why is it that I need maybe to have a run? What does it help? what is our responsibilities as individuals before we find ourselves in burnout situations?
By the way, I'll repeat the same about the endoscreen. You remember when you were in school, some teachers were creating the physical education time to be mathematics time.
True.
But they were not aware of the danger they are doing to the child. Because there's a child who has been born without fully developed brain.
True.
When you go to the field, the endorphins I talked about, it triggers and it makes the body to start developing slowly. So you might say somebody who is in a special school. Those people, they are supposed to do a lot of exercises. Most exercises of climbing, because in climbing, your eyes is always set on where you are touching. Okay, so that the endorphin can be
triggered,
and the oxygen to have the supply of the brain in the knee.
All right.
Yes.
So you have been working in this facility for how long now?
We started which year? I think around 4 years. 4 years. 4 years. And as I said, we have many of the guys who have come through this place, and they have gone so many rehab centers. We have somebody who is already employed by Mheshimiwa Mukonji, and is my friend. This person is very bright or intelligent in IT sector. And I will tell you that, and he comes from a rich family. He has been taken to all the rehabs in this world. But the last time he came here, he told me this is the right rehab he has ever seen. Because all other times, he was being told by the big people, hey boy, I'll see you in the afternoon. Nobody sees him. But he's still in the rehab. But here, when you enter from the gate, you are served well. When you go to the manager's office, to the director's office, by the time you reach to the councils, you know, it is perfect. Everything works smoothly. And everybody, and they will say, they just say that things are done very well here. We also have another one, who is my friend. By the way, he has paid a ticket for me to go to Ramu.
Wow.
He was here, and now he's okay, he's working. We have another one employed by the governor, Kirinyaga. So the people have passed through this place. They can tell, and I wish we had called them. They give their testimony.
We will be able to have a sit down with them so that they can be able to give us testimonies of that rehab works, as long as the people that are there are doing what they know what they are doing, and they know what it entails. I came in the morning, I found you doing exercise with the people that are in the rehab sessions at the moment.
Yes.
How would you tell us, as we conclude, is their thought systems once the exercises are done?
You see, as I said about the brain, always when you do the exercise, you see somebody who is just walking. Somebody who is very dull, just because of the drugs, the body is very big. But when you start doing the exercise, you reduce the weight. When you reduce the weight, then he's anxious. The anxiety comes out of him, and now he's concentrating with what we are. And normally when we finish with them, there's always the Bible verses. Where we read
the affirmations part,
which is connecting with whatever
you're doing
in the field. So they see the biblical part of it and the physical part of it. And they are so happy. I normally comes here at 6 in the morning. So immediately after the exam, they go and take a bath and they go to the classes.
Well, we have come to the end of our session. Today it was all about Mr. Njero telling us what is the importance of the physical activities when it comes to stress management and mental health. So thank you so much for showing up. I want to believe that we'll keep on having these sessions. Next time, Madam Director, I know she can see me from wherever I am. Your team will be here. Wakuja na tracksuit, so that we can be able to do these exercises together and we be able to walk the talk that we are talking. So until next time, keep it inclusive reflections, and please check out our Cynert Hospital and Rehab Center for more services. I think you've heard testimonies, and I want to promise you we'll keep on bringing all this together with you, with the team, so that we can be able to enlighten you on mental health, stress management, and the importance of not only physical, but all-round importance of being mentally healthy. So, good morning or good afternoon from wherever you're watching us from. Welcome again to another segment of Inclusive Reflections. And today it's an amazing day because we are here with an amazing team that works for Cynert Hospital and a Rehabilitation Center that is in Embu County. Why are we having them today? May has been the mental health month, and we did not manage to have a mental health conversation. I promised you that we are going to be bringing you content that is relating with everything that happens in our life, our daily life. So today is not an exemption, and in partnership with Cynert Hospital, we have these amazing guests with us. We want to know what is mental health. You can see the way they are looking nice. They are smartly dressed. Myself, you can see, nimekuwa member. So please, we invite you for this conversation because mental health is something that is affecting you and I in one way or the other. Out there, we have a lot of stigmatization. We have a lot of misconception. We don't know what mental health is. But I'll tell you this, even before we get the director to say hi to us. The same way you take care of your body. When you're sick, you go to the hospital. It's the same way you're expected to take care of your mental health. So today we want to learn about all that. But before we get to our amazing guest, allow me to introduce to you Madam Director. Good morning, Madam.
Good morning.
You're well? Thank you for having us.
Thank you. And today we are delighted to have the team from Inclusive Reflections to come and partner with us as a kind of a continuation of the Mental Health Awareness Month, which just ended on Saturday. And the theme of the mental health month this year was unmasking mental health. And we did a lot of activities to mark the month, culminating into what we call the Embu Wellness Tea Weekend on Friday 30th and Saturday 31st. And we had stakeholders who came and celebrated, created awareness. We shared a lot, and also over a cup of tea. Why did we call it Tea Weekend? Because also May, in the month of May, we were celebrating International Tea Day on 21st May. And as you know, tea is an anti-stress. So I'm happy to have you with us, and I'm happy to have my team who together we are going to talk about the services we are offering today. Cynert Hospital and Rehabilitation offers majorly two types of services. The mental health services. We also have the medical services. And the medical services came recently. We began first with the rehab, and we saw the need to incorporate the medical wing, because usually when clients come with mental health issues, more often than not, they also have medical conditions, and we realize that it's good to have them on board. And after all, addiction normally affects even the body physically, and they need medical attention. So that's the reason why the Cynert Hospital and Rehab was born, offering both the medical and the mental health services. So I wish to welcome all of us to today's discussion. Mental health is my passion, and I was privileged together with my co-director to start this rehab after interacting with very, very many young people who needed rehabilitation, who needed to be talked to, and looking around also in the community, addiction and the issues of mental health, they are rampant. And also young people committing suicide. Personally, I was affected before I started this rehab. I was affected as a family. We were affected because we lost our brother. I lost my brother through addiction and finally a suicide. And that is the reason that is what gave me the passion to start this center. So welcome to the mental health discussion. we are going to have today, and we are always open as Cynert Hospital. We offer services in a comprehensive manner. Our mental health services are very, very comprehensive. Like you've seen, we incorporate sports therapy, we incorporate psychotherapy, we incorporate addiction counseling, detox or treatment for those who need treatment. We also have a spiritual therapy. So it's very, very comprehensive, as you're going to hear from the experts of the Cynert Hospital and Rehab. Thank you.
All right, so I'm going to ask, you've heard from the director, and most of the time I'll tell you, when something is born out of passion, when you have experienced something, you know the pain. You can imagine the pain of losing a brother to addiction. And I say this because we need to dig deep to why people are getting into whatever it is that they are doing. I have seen the services they offer. I've been here, I've been going around, I've seen people that are going through addiction in their sessions, and I'll tell you, it is an amazing work that Cynert Hospital is doing. So today, I want the panel to introduce themselves. I can see Madam Susan, then we have Daktari on the other end, so that we can kick in our discussion. You introduce yourself through that camera, then tell us what is it that you do in Cynert Hospital.
Thank you very much, Terry. My name is Susan Mogera, a counseling psychotherapist, and also a manager of the center. You're most welcome as we continue with this discussion.
I'm Nelson Mainge, a clinical officer here at Cynert Hospital and Rehabilitation Center. So I deal mostly with the medical side and also the pharmacotherapy of the mental health clients that we have, and we are delighted to have you.
Thank you. I'm Kanidi Patrick, a clinical psychologist, specialist in addiction treatment and counseling at here Cynert Hospital and Rehabilitation Center, and I'm much happier to have you guys here.
I'm Benjamin Wafula, a clinical counseling psychologist and addiction specialist here at Cynert Hospital and Rehabilitation Center, and I'm so happy to see you here with us. Thank you.
All right, then you can be able to relate to all of them and know what is it that they do. So every one of them is going to answer our questions. Our questions, they're not my questions. You know, I'm here on your behalf. Our questions, the best way possible, are based on their expertise. So we don't want to waste any more time. Thank you for having us. We are happy for this partnership. We are hoping that as time goes by, we'll be bringing new sessions. We have already done one session with a sports coach, and it entails what it is that the physical activities have to do with the mental wellness. I am sure that we are going to see that clip and you'll be able to relate. Why is it that you need to walk around? Why do you need to jog? When do you need to go to the gym if you can access one? And how does it help you to cope with stress and also the mental health issues? So without wasting time, please, you're going to be passing this mic to whoever is going to be answering my question. And we start, I think, with Susan. Susan, what is mental health? Oh, it's Daktari, sijui. What is mental health?
Mental health.
Okay, so what is mental health? Mental health means the state of optimal well-being in terms of your emotions, emotionally, psychologically, in terms intellectually. So the state of optimal well-being in these areas, in terms of the way you think, the way the way you express your emotions, optimal well-being in this area is what we refer to as mental health.
Okay.
So it has something to do with our moods, our emotions, the way we think, all that. The state of optimal well-being in these areas is what we refer to as mental health.
So that means mental health is not mental illness.
Yeah.
I'll be right to say that there's a big difference between mental illness and mental health.
Yeah.
Because I'm sure some people think mental health is it's like mental illness, but those two ones are different.
In
so
fact,
what is mental illness? Give us the difference between mental health and mental illness.
Okay. Before I answer that,
Yes.
even the WHO definition of health, not just mental health, but health in
Healthy.
general,
Yeah.
this is the definition of the World Health Organization. That health is the state of optimal well-being, physically, emotionally, psychologically, and not merely the absence of a disease or infirmity.
Okay.
Yeah, so that is it. So if we're talking about health, it's just a state of not just the absence of disease or infirmity,
Mm-hmm.
but optimal well-being. And now we have physical health, we have mental health.
Mm-hmm.
So the question was the difference
Between mental illness
Mhm.
and mental health.
Yeah,
For someone that would think when we talk about mental health, you're talking about mental issues, and me, I'm okay.
yeah,
Yes. You see the misconception that let me say it.
yeah,
Africans we have.
yeah,
I am not mentally ill.
yeah,
I am okay. So people don't understand that emotions part of well-being is connected is the mental health we are talking about.
yeah,
Some people would think it's about sickness, but I
yeah,
know it's not.
yeah.
Yes.
Okay, so the difference between a mental illness
Mhm.
and this whole concept of mental health uh, is that, okay, a mental illness, most people have an idea of what a mental illness is, somebody that is not okay mentally,
Yes.
the people maybe we come across in the market, such
Mm-hmm.
people. But actually, mental health deals with more than that. It actually deals with our mood, our emotions. There's some conditions that are not per se mental health conditions
Mm-hmm.
as the ones that people are familiar with.
Yeah.
But somebody is affected in their emotions, their moods,
Mm-hmm.
and they are not mentally okay. So when we talk about mental health, we are talking about a person being optimally well,
Mm-hmm.
even in terms of their emotions, not just merely having psychotic symptoms.
Yes.
Yeah, so a mental illness is a specific disorder that requires treatment, but mental health it's actually broader than just encompassing the illnesses that affect a person mentally. So it
Okay.
has to do with the mood, the affect, emotions, well-being in these areas.
Yeah.
Yeah,
All right. So am I going to be right if I say, from a doctor's perspective,
yeah,
PTSD, the anxiety, and depressions, those are some of the mental illness
yeah.
that we have?
Yes,
Mm-hmm.
you're right.
Okay.
Yeah.
All right. Thank you, Dr. for that. So at least now we have an idea of what mental health is. And I think this issue of mental health has not been there for long. It is just started just the other day. I think with the rampant cases of addiction and everything that is causing people to have mental issues, we have seen people that have issues to do with anxiety attack and panic attacks. Medically, what causes that? Would we classify that to be a mental illness or a mental health issue?
Okay. Mhm. So you've mentioned something about anxiety attacks and panic attacks. Yeah.
Yes, because again, I know there are people that would have panic attacks and they don't know what it is that is happening to them.
Yeah.
Yes.
Mhm. So thank you for that question. So, okay, these are examples of conditions that, they're just part of what we call mental health. They're not necessarily, but again, it depends with the severity of these cases. We have some cases of generalized anxiety disorders
Yeah.
that even require pharmacotherapy, treatment with medications.
Mhm.
But there are some cases of such issues that just require counseling and psychotherapy.
Mhm.
So depending with the severity of these cases, it can either be a mental illness
Mm.
or just something that needs to be addressed by counseling and not necessarily medically treated.
Okay.
Yeah.
All right. Thank you very much. I think now we are in a better position to understand what mental health is about. Maybe my next question would be, let's talk about stigma. The stigma that comes with mental health. We always gonna be in denial, or a family can always be in denial of dealing with a mental case. Let's talk of a son or a daughter or even a parent. So what would you say are some of the stigma that we face in the community in terms of mental health wellness? That one, is it for Dr. Susan or yes?
Yeah. Thank you very much, Terry. We've just listened to Dr. Nelson speak about mental health. of the mind. And to get to the question of what we refer to as stigma, we realize that most of the conditions, particularly those that have to do with mental illnesses, mostly we realize that the family and even the person is somehow in denial. When you're asked about, let me put it this straight, Terry. Sometimes it's difficult to realize that you are suffering from a certain condition. It could be an anxiety, it could be a phobia, it could be possibly the doctor suddenly realized after assessment that you have a condition.
Yeah.
And in the society, you realize sometimes people only look at what they can be able to see physically. So when a condition which has to do with the mind is somehow identified or assessed, or the news are released to you, the client or the person gets into what I would call denial. This denial leads to what I would say there is some stigmatization. Let me say, for instance, the clients or personally, I realize I am unwell, and it is spoken to my family that I have a condition that requires treatment. People associate it with the beliefs. Some it is beliefs, some it is witchcraft, some it is a condition that they might not be able to understand medically. And therefore we get the family getting into isolation and into stigma. So stigmatization generally is trying to associate that sickness, and people maybe may take it very personal and they get into a lot of denial. Others are stigmatized by what people tell them. That they tell them, hey, check, Susan is suffering from a condition that has to do with the brain, and thus she's not well. It leads to a lot of isolation and stigma.
What do you think as a society we should be doing to try and alienate the stigmatization from the society? What can we do? Because part of this conversation, as where we are having it, is to bring into light what mental health is about, what mental health is not about. What do you think institutions like this one, churches, workplaces, as HRs and the people that we work with, employees, we are trying to bring programs and sessions about it. But as a society as whole, what can we do, even as individuals?
Thank you very much, Terry. As a society and each one of us, one is to create awareness. Is to create awareness for those that can really understand what mental health is. We realize there's a lot of most of the communities are so much unaware about mental health diseases and wellness. The other bit that we can do as a society is acceptance. Acceptance that mental health is a disease like any other, and it is also creating awareness also by identifying institutions such as Cynert Hospital and Rehabilitation Center where you can seek help. One is to demystify the conditions and accept that it is a sickness like any other, and be quick to offer help and assist.
All right. Yes, Director.
I would just encourage families and any person in leadership or community as a whole to be alert. When you see a person is not behaving well, is isolated, because today we are living in a world that has so many issues. You know, there are economic problems, financial issues, and also drugs are rampant, addiction is on the increase. So I think it's identifying that someone is not well, and you encourage him or her to speak it out. Like the theme of the last, the May month, this year's mental awareness month was unmasking mental health. Let's not hide in the masks. We are wearing masks, pretending that all is well, because again, we don't want to be known. You don't want to be seen going to a counselor. Do you know today, even we have pastors who are even committing suicide? The statistics tell us actually 1 in 4 Kenyans have mental health issues. What does that tell you? That people are stressed, people have issues, and they need to speak out. They need to go to counselors. They need to say, hey, I'm not well. I'm not able to relate well. I'm not able to work well. I'm not thinking right. Some women hide and they keep crying, you know, every day, you know, behind the curtains. They don't want to talk about it. Let's all talk about it. Let's unmask the mental health by saying there should be no stigma. It is understanding and encouraging one another to seek help, such as coming to this institution.
Okay.
Thank
Let
you.
me ask a question. You're the director of the institution where we are at the moment. And let me tell you, a lot of people will fear the judgment of, we have people that are well up, but you see, mental health doesn't choose. It's not about the financial status of a family or anything. So when the person that is on the lower side financially is struggling to access the services because they cannot afford, the other one is struggling to access it because of the fear of judgment and all that. As a director, how accessible would you say the services are in terms of therapy, in terms of the medical, for the extreme cases that need medical attention? And what are you doing? What are some of the programs and the sessions that I know you have started? There was mental health tea the other day. Unfortunately, I wasn't around. I could have attended, but I will attend the others. What are some of the programs and the sessions the society is expecting to see? Either some are ongoing or you are planning with your team to bring on board.
Thank you very much. In our programs, we have youth-friendly programs, and we partner with institutions. They can bring their youths here. They can also bring groups. Sometimes we bring, men, like we have partnered with the Boy Child Justice Alliance. And occasionally they can bring the boy child here. We can have day programs. We have what we call the Car Need program. And this is a program that we run. We can either run it for a day or even for a few days, even for a weekend, or even 1 week, depending on the availability of the people. We partner with the youth programs, other NGOs, like we have partnered with Enable Africa International, just to support mental awareness activities. We also have outreach. We've been to Bita. Bita is in Chicago, and where they have very many cases of drug addiction because of Mira. And we tell them they are not, because many families believe that their children are bewitched. And that brings a lot of stigma in the society. They don't want to talk about it. They are even ashamed that, and they hide them. We've actually rescued some clients here who are actually they were in the house. They were kept in the house, tied with ropes, and they've come here and they have walked away whole and, and being able to lead normal lives.
Okay.
So there is a lot of stigma on mental health. Now, you've asked how accessible. We are SHA accredited, and SHA is able to actually meet some costs, partial costs,
Okay.
at our level, because the hospital is at level 3, but we are actually renovating to go to level 4, and we are hoping at level 4, then SHA will be able to actually meet a significant amount of treatment. But that does not stop us from actually partnering with well wishers, and we've done that. We have rescued and we have even supported, freely. We actually hold mental health camps,
Okay.
free of charge, and we are able to reach out to communities. So we are doing a lot in partnership with people who are able, who are actually in the area of mental health, in the mental health space, and we welcome them so that we partner together.
All right.
Thank you.
Maybe to add to what director is speaking on to the programs.
Yeah.
We on the mental health counseling, we have individual counseling therapists, we have family therapists, we have addiction counseling, and to add to what I would say, during the family therapy counseling, it is really inclusive of all family members who really require the therapy.
All right.
And when the clients are here in the center or are abroad, or we also have spiritual therapy. We also have spiritual therapy at the center, and it is good to know that we have realized it does help families and ourselves quite a lot.
Okay. All right. Before even you pass the mic, I think the last question I have for you before I come to the one that deals with addiction. What are some of the signs that you'd say? These are some of the signs of mental health issues. This particular person could be having mental health issues. Dr.
Thank you very much. Once the client or a person is brought to the center, we have what we call a comprehensive assessment. And the comprehensive assessment is done by the team that you see in this panel.
All right.
The clinician will do their part in order to understand that this person has mental issues. We shall do what we call an assessment. And this assessment is done by the clinicians, by the addiction counselors, and by medics.
Okay.
You've asked about the symptoms. Generally, you realize that the people or the guardians, the families that have realized, as Dr. Eva has just put it, that there is something that is not okay with the person they are bringing to the center. During assessment, they are able to speak for quite a while of some of the signs that they may have seen, some of the signs they may have seen with the person. And I'll request Dr. Nelson to possibly point at some of the signs that during assessment are seen as he passes over to the addiction counselor.
Okay, thank you so much. So some of the most common signs and symptoms of mental illness.
Yeah.
Okay, I'll begin with the most common ones and then the others that are maybe prevalent in the more severe cases of mental illnesses. So the first one, we say that it has to do even with moods and emotions. So one sign of a mental illness is feeling sad persistently, even for no reason at all. There's some patients that I evaluate, and sometimes a person just, the main complaint is that I just feel sad all the time for no reason. I cannot explain it, but I'm just ever sad. So that is one sign of mental illness, feeling persistently sad. Another thing is what we call insomnia or lack of sleep.
Okay.
And if a person is not okay mentally, or if they have a mental problem, either they'll not have sleep or they'll be sleeping too much. So either sleeping too much or not sleeping at all, that is a sign of a mental illness.
Okay.
And then we also have what we call hallucinations. These are perceptions of things that are not real. We have what we call auditory hallucinations. This is a person that hears things that are not there, or what we call visual hallucinations. A person is seeing things that are not there. So these are all signs of mental illnesses.
Okay.
Yeah. So, okay, those are some of the most common ones. Well, we also have others, like something that has to do with orientation. A person can be, especially for the more severe cases, a person is not oriented to time, place, and person. Memory is affected. So if there's somebody at home and maybe you have somebody and one of these things is evident,
Yeah.
you can bring them for assessment. So there'll be impairment of memory, emotions. Somebody is either feeling sad, and even somebody we have what we call manic phases, especially for bipolar 1 disorder. Somebody can just be ever happy and euphoric, for no reason at all, and not even intoxication, but somebody is just ever happy for no reason, ever talking. That's also a sign of a mental illness. Somebody is just hyper. So those are some of the few symptoms that you can possibly see and know that a person is suffering from a mental illness.
Okay.
Yeah.
A question.
Yes.
Do you have mental health cases with kids?
Yeah, definitely. We also have pediatric mental illnesses, and they're so prevalent. Yeah, we do have cases of depression for pediatrics. For the young children, they can have depression. We can have what we call early onset schizophrenia, or acute psychosis, even in the young children. So, yeah, these are not just restricted to the adults and the older individuals. Even children can get mental health conditions.
Maybe briefly, as we come to being told time, what are some of the signs that a parent should look up to when it comes to kids?
Yeah.
Because I have a feeling like because of the stigmatization, lack of knowledge, the ignorance part of it, some of the cases that we are having right now, the kids have grown up with the adults right now. Our parents back at home could not, like, there was nothing like mental health.
Yeah.
I think some of us have started hearing about mental health just the other day.
Yeah.
So growing up, some of these people have grown with conditions.
Yeah.
And maybe now they are parent, they are seeing their children behavior it's not okay. What are some of the signs that a parent should look up to when it comes to the children and mental health cases?
Yeah. So the first thing that a parent can note in a child is loss of interest in their day-to-day activities. For example, sports. You can have a child that is normally playful, but you just realize that maybe for the past few days, this child is not interested in going out for sports, watching TV, maybe as they used to. So loss of interest in their activity, that is what medically we call anhedonia. That's a sign of a mental illness in children. Social isolation. For example, this was a child that used to hang out with friends and go out to play, but maybe recently you've noticed that this child just wants to stay at home, doesn't want to interact with other people. So that is a sign of a mental illness that you can see and know that the child is not okay. The others, as I just mentioned, persistently sad. The child is just sad for no reason, even feeding. Failure to feed well is also a sign of a mental illness. So inability to sleep well or sleeping too much, loss of activity in the daily, loss of interest in the activities that maybe they were previously engaged in. These are some of the signs that a parent can see and maybe possibly seek assistance for their child.
All right. To our viewers, you've heard your parent, your child has started withdrawing. They used to go out to play all the time. they are sad, they are not as jovial as they have been. I normally say that motherhood and parenthood does not come with a manual, but it is in such kind of forums that we create to bring knowledge to you so that you can, all you need is just watch it, share with your friend. Maybe they have been telling you, mtoto wangu anafanya. We are here, and this session, we are making it because of you. Parenting is not easy when it comes to mental health. It doesn't matter whether to an adult or a child, but every parent's desire is to have a wholesome child. So please keep heed to whatever the doctor has said. Look out to those signs, and if you see your child or your friend's child or someone else is suffering from such, please, you can advise them to go for assessment, and so that they can be assisted as early as possible. So we want to come to our addiction friend here. We are going to have a discussion with him on mental health because he deals with mental health because of time. So, Daktari, please tell us the relationship between, by the time we get into addiction, I know this is a broad topic. I've had conversations with people that have been into addiction for years and years and years, and I'm proud to say that they changed, they are making progress in their lives, and they graced our show at one point or the other, and their story, I realized it created quite a discussion online because some of them are very well known. So would you tell us what is the relationship between addiction and mental health? What leads to the other?
Okay, thank you, Terry. When it comes to addiction and mental health, first of all, there is a quote that says, all of us, we deserve a life, abundance of happiness and health. And when it comes to mental health and self-care, they play a great role in our lives. So at the end of the day, you find that mental health or the mental illness that is can lead to addiction. That is drug use, either it's alcohol and substance of abuse, and also drugs of abuse can lead to a mental condition or a mental problem. So they go hand in hand. So one can lead to one another. And that's why you find the majority of the people who suffers a mental problem or a mental condition, you find them, they either use one of the substance or two of them to cope with the condition. There are others whom they end up masking that they are okay and they are not. Especially for men. Let me put that as a signal because we are mostly affected. And according to the research, even ladies, they are using these things based on the mind that they don't use openly. But women, once we begin using today, tomorrow you will find me the outside. Because I want to show you people I'm a man enough. You see? And that makes people also continue using those substances as well, going deeper into mental conditions because they don't want other people to see that, now you see that guy has a mental condition, maybe he has been bewitched, or other things which have been already discussed about the misconception, about the mental conditions. So that's why we find us as the professionals, we try to talk with the parents or the guardians of the clients or the people who are suffering mental conditions because some of them they don't understand. Maybe stress or depression or maybe it's an anxiety disorder which has made this person to indulge into alcohol and substance of abuse. But they could be saying, now you see, he has been just using and they don't understand. That's why Madam Sue has noted that during family therapy is very important. We make the family members understand what has contributed to this use of these substances. Maybe it's not a mental condition or other factors as well, which they may have not identified on the other side. And as per se, today we have around 55% of people who are living with mental conditions and they don't seek treatment because of stigma. Not many people come here and talk about their mental health. And I'm very happy with our directors. They have come up with that thing of bringing these programs based on the mental conditions or the mental wellness. That is.
All right.
because it helps the community and also other people who are in need of understanding the term mental conditions or mental wellness and other conditions related to such.
All right.
Yeah.
Okay. Your discussion is coming in the next few minutes. I would literally need to understand addiction when it comes to men's mental health, because that is where everything is like covered. We would want to unmask that discussion. In a few minutes, we'll have another session. So, offer to
Thank you.
our. He's a therapist or a counselor.
I'm a clinical psychologist, also an addiction specialist. Yes.
Let's talk about coping strategies and self-care before we get to coming to see you for counseling and all that. What do you think are some of the things that a mental health person or a family that has an individual with mental health cases should be looking at to start maybe to cope? Or what does coping and self-care entail generally?
Okay, thank you, Terry. First, I will start by defining what is a coping mechanism. And a coping mechanism, these are strategies that we use to cope with the daily challenges that we face. And when you talk about a coping mechanism, it can be either a healthy one or an unhealthy one. So it depends. Some of the people may decide, let me take alcohol so that I can ease my pain. Let me use a certain substance so that I may mask my symptoms. But you see, that is a negative coping skill or unhealthy coping skill. You as an individual, maybe I will come to answer one of the questions that you had asked earlier about the causes of mental health disorders or illnesses. And one of it is stress and genetic factors. So you as a worker, for example, me as a worker, I might have a challenging day. I might have a difficult client. I might be passing through a lot of things. Being a man, being a father, being, a psychologist and all that. I may be undergoing a lot of issues. And I can decide to mask my pain, to mask my symptoms by using alcohol. But else, I can also decide to talk it out. I go and share with Mr. Patrick, I go and share with Dr. Nelson, and that thing comes out of me. So it depends with an individual. You may decide to have the negative coping skills, or you can decide to have the positive coping skills. For us, we need people to be using the positive coping skills in our day-to-day activities. And some of the coping mechanism we can have is deep breathing. And just take that a deep breath, and you will feel relaxed. Another thing, you can decide to take a walk. When you feel that you are bombarded with a lot of things, you can decide to take a walk. Just walk, even in the nature, just walking around, and you'll feel well. Another coping mechanism that you can do is writing. Writing the unsent letters. For example, if you are suffering from grief, most of the people who are suffering from grief, they don't know how to express themselves. They don't know how to say that this person has gone, but I feel in one or the other, I might be the cause why he died or she died. So I encourage people to write the unsent letters. You write how you feel about that person, you write how you feel that thing happened, but you don't send it because it's not even alive, no? Yes, after writing it, you discard it. Also, another thing that is very important is keeping a journal. Always remember to have a journal. And a journal, we say, is a personal book, a dedicated one, that you write how your day was, how you felt during the day, how the activities have affected you during the day. And it has really, really helped a lot of people. Another thing, you can decide to give yourself space. Sometimes you find you are here working. On Saturday, you are somewhere else doing another show. But you need to give yourself a space. Yes, give yourself a space. Don't wait until December that you can say, okay, I'm going for a dunda, I'm going for a vacation, I'm going for... No, always give yourself a chance, a space to enjoy yourself.
Yeah.
Okay.
You have dealt with clients.
Yes.
You are a counselor. I want you to briefly, because we are coming to the end of the show, talk about suicide cases. What are some of the signs? Because I know that a lot of us have been victim of someone committing suicide just from the blues and all that. Some will show signs, some will talk about it, but let me say this. If someone is an addict now, they're like, siku moja nitajiua. Sometimes when the family is really worn out because of trying to find a solution for this particular person, some of them take it as a joke. We are like, si tushamzoea, ataenda tu nafanye nini? But one of these fine days, whatever they are saying, they carry on with their threats. So what are some of the suicide case signs that we can look up to and I think we need to take a step?
Yeah.
And how can we help that person out of that? Nini na driving someone to, I just don't want to live anymore. Yeah.
Okay. Thank you, Terry. I will classify the symptoms into 3 categories. One, we have the behavioral symptoms of suicide. We have the verbal signs, and we have the psychological part of it, the cognitive part of it.
Yeah.
When you talk about the behavioral signs and symptoms of a person who is about or maybe is thinking about committing suicide, you might find a person has started cutting himself or herself, self-injury. Yes, you might find a person has tried severally, maybe to harm himself.
Yeah.
When you talk about the verbal signs, the verbal signs, you can find a person, okay, we might be seated here, and I just say something like, hey, do you know me? By tomorrow I'll not be here. And by speaking like that, or by talking like that, I'm just like, I'm concluding the whole thing about me leaving the world.
Yeah.
I'm concluding the whole thing about me doing the act of getting suicidal acts. So you might find a person thinking, having thoughts about suicide, but has no behavioral signs, has not talked it out, but he's thinking about committing suicide. So we as counselors and professionals, and also as people out there, maybe a HR, maybe an employer, we need to have a close relationship with these people. When I say I want to harm myself, you don't need to judge me. You don't need to tell me, oh no, that is just a small thing. No, to you it's just a small thing, but to
Be a
me,
man.
yes, but to me it means a lot. Or even in our society, you're told you should not cry as a man.
Be a man. Men don't cry.
I'm just human. I can cry like any other person.
Yeah.
So we need to listen to these people. When I say I'm hurting, try and know what is it that I'm going through.
Okay.
Yes. And also, I can urge us as professionals, when you're out there, not necessarily being in a facility, but when you're interacting with people, just try and know how they are. Just check up on them, ask them, have you eaten and all that. Like right now we're going through a lot of financial issues in the government and all that. So you might find a person is feeling like, no, I think this is the end. I can't go any further. So you need to be there for that person and create that conducive environment for that person to heal.
Okay.
Yeah.
Let me ask. You have mentioned 2 signs. Are they signs, right?
Yes.
One is verbal. The other one is?
We have the cognitive one. We have the verbal.
There is the behavioral and verbal. Between the two, which one is the worst? Leave alone the cognitive one. There is this one that will be telling us, namjua nitakunywa dawa. There's that one. But there is this other one. I tend to feel as if the other one is more dangerous because he's not saying anything. So one day, you just be surprised.
Okay, we have these people. We have 2 kind of people. One is that person who can shout. Even though he's not sharing the whole thing, but he's trying to communicate something out there. But you have this other person who is more reserved.
Okay.
So the reserved one may tend to give you signs like deleting Facebook account, quitting or getting out of all the social media handles and all that.
Yeah.
We have those people, but we have the other one who makes jokes. Okay, they're jokes, but they have something neat. Like they say, I'm going to die tomorrow. I'm going to give out my wealth tomorrow. Yes, but all of them, they carry the same impact.
Okay.
Yes.
All right, I'm being told time is up, and because I know that we are having another session discussing mental health, I want to bring this session to a close. I want to take this opportunity to thank the team for your expertise. There is one that has not spoken much at length. We are going to have him for a very long discussion of men's mental health discussion. So to our viewers, we want to take this opportunity to thank you for always staying on board. Thank you for your support. We promise that we'll bring in new content and guests that are expertise in one area or the other, and so that we can share the knowledge. This knowledge, when you hear it, please share it with someone else. And thank you so much, because I've seen you do a lot of sharing. Please, this session is not an exemption. Again, if you're in Embu, Cynert Hospital and Rehabilitation Center is located in Motondori Market along Embu Meru Highway. This used to be the old, we knew it as the old evening boarding school, right? So I think if I give that is a bit. Then here, what is the name of this hotel? Remind me.
The Marvel.
It is opposite
Marvel.
Marvel Hotel. Najua hakuna mtu ajui Marvel. But if you are not around Embu County, we'll keep on sharing direction of the facility, and I promise you that whatever they offer here is a solution to many things that we have discussed. They have introduced the medical facilities services, and I'm sure together with the rehab services and the mental health sessions that they have, you're going to benefit. We'll be sharing more of what the facility does in our sessions. So please keep tuned to Inclusive Reflections. To the team, I want us to say goodbye to maybe the last word from the Madam Director as we finish, as we close the show for today. So thank you very much, and thank you, my team, and for having this discussion. For us, it is our passion, it is our responsibility to create awareness on mental health, and for the inclusive team, please feel welcome to come again. And to everyone out there who is feeling needs to talk to someone, we have wonderful counselors. We have doctors, even consultant psychiatric doctors, addiction counselors, and we offer a comprehensive mental health treatment, which is spiritually based. We use the AA, the 12 principles of addiction. So our addiction package is also tailor-made on the 12 steps of AA, which are actually based on the Bible. So spiritual therapy is key in this rehab center. So feel free to come. We are open for everyone. Thank you, and come again, the inclusive team. God bless you. Thank you so much. Keep it inclusive reflections. I'm your host, Teresami. Here we inspire one life at a time. Kindly don't hesitate to share this video. Engage us in the comment section. If they have addressed any of the areas that you do need more clarity on, please engage us in all our social media handles. We have not yet opened an inclusive reflection page. I'll go by my name, Teresami. So you can engage us if you want maybe one of them to specialize in a certain discussion at length. Please feel free to engage us. We are here so that we can bring you the knowledge and the expertise, and so that we can be sure that at the end of the day, we are assisting one person at a time. So until next time, may God bless you. May the Lord keep you. Subscribe to our channel and share our content. Thank you.